Thank you. Okay, it's noon. I'm going to call the Human Services Committee to order. First item of the agenda is to approve the agenda. Chair will entertain a motion to approve the agenda.
I'll move to approve.
Thank you, Commissioner. Thank you, Commissioner Baer, for support. All in favor of approving the agenda, please say aye.
Aye.
Aye. Any opposed? Thank you. Appears to pass. Next item on the agenda is public comments. Is there any public comment? Any public comment? Thank you. Public comment is now closed. We move on now to approval of last month's minutes. Chair will entertain a motion. Thank you. Movement by Commissioner Baer, supported by Commissioner Snell. Any discussion? All in favor will say aye. Aye. Any opposed? Thank you. Appears to pass. Next item on the agenda, the Lifeways monthly report, and Director Leonard is here. Good to see you, ma'am.
So good afternoon, Commissioners. So you'll see in your packet today, I want to point out a couple of things. One thing that wasn't included in the packet at the time that I submitted the report was the fact that we did have the walkthrough with Mercer and with the county facilities for the last phase of the building remodel. We are very excited about the fact that we should be getting this week the occupancy permit so that we can move staff into that space. And we are very excited about the partnership, the hard work that's gone into this project, and especially the work that's been done by the county. It has really been a phenomenal partnership, and we appreciate it, and I know my board appreciates it as well. The other thing that's included in your packet is an update relative to our strategic plan. So we are wrapping up our third year of our plan, and we just had in August a strategic planning summit for an opportunity to kind of look at where do we need to go, looking at the environment around us, both at a national, state, and local level, and internal to the organization about how to plan for the next 3 years. So we will be releasing that and taking that to the board here in October, but for wrapping up the final month of our current strategic plan, I'm very happy about a lot of the accomplishments of the organization over the past 3 years, a lot of growth relative to service delivery and expansion, especially in the areas of crisis services, and you'll see that in the packet. We have a continuum of services now that are available for the community around dispatching mobile teams, both for adult and children. We have a crisis living room model where individuals can come and we provide support to de-escalate the situation and get them connected with ongoing services. We also have our crisis residential, and since I reported last month, we have received our temporary license. We have 2 positions to fill, and once those positions are filled, we will be able to open our crisis residential where individuals can stay up to 14 days. It is important to note that like many organizations, probably the county might be experiencing it as well, or at least some of your departments, is the challenges relative to workforce. So we are continuing to do what we can relative to recruitment, but I do want you to know that that has been a challenge for Lifeways, and I anticipate that it's not unique to Lifeways. The other thing that you'll see included in your packet is the growth relative to diversification relative to our strategic plan of funding. Over this past year, we have been successful in obtaining close to $3 million in funding that supports the work, the crisis work that we're doing. And we were excited to hear that we also received this past month the Michigan Health Endowment Fund that will allow us to be able to do some really targeted outreach efforts to those communities in Jackson where it is a struggle getting them connected with mental health services. So that's an exciting opportunity moving forward. You'll see in the packet as well the discussion around relative to our strategic plan, the partnership with our local law enforcement, both with the city and with the Jackson County Sheriff's Department. A lot of hard work over the last several years to really partner together to address the needs of those with mental health issues in our jails and in our community. And where we are at this point in time, we are sending both Lifeway staff, city police staff, as well as sheriff staff to the CIT training, which will be a train-the-trainer model, which will allow us to implement the training and get to a point where we can develop a co-response model within Jackson. And we're really excited about that, and I know that they are very excited about that partnership as well. The next thing that I would like to, and I mentioned this last time, was around the fact that there are bills out there for behavioral health reform. There are bills on the House side relative to the Republican side from Representative Whiteford around health reform, or behavioral health reform, and then we also have behavioral health reform that's being proposed by the Senate Majority Leader Mike Shirkey. That is actually now at committee level, his proposal, and there will be a meeting actually tomorrow where the committee will be hearing, but it's only certain individuals at this point in time who are invited. So I was told that I will be able to go and speak on the 21st relative to the proposal. But then if things don't always get exciting, there is now also, that we learned last week, so the Democratic on the House side caucus is also proposing and wanting to propose behavioral health reform. And so they are going to be having some listening sessions. I don't know when those are at this point in time, but as soon as I do, if there are any commissioners who might want to speak on that, I'd be happy to share the dates and times of those listening sessions. So that is where we are relative to the current reforms that are out there and proposed reforms. You'll see in your packet a summary of the meetings that I had in August with both Representative Whiteford as well as with Senate Majority Leader Mike Shirkey. And then the last thing I do want to let you know about are there are two events coming up. One of them is the Jackson Suicide Coalition Stomp event. This is an annual event. This year it is going to be a joint person and virtual, so you have the opportunity to participate virtually if you, with the current COVID cases, do not feel comfortable attending in person. If you have never attended one, I know I say this every year that we have one, but if you've never attended one, it is a very emotional, impactful event. With 1 in 5 individuals experiencing a mental illness, all of us are touched in some way in our lives. And it's an opportunity for us to be there to support people that struggle with suicide, and also an opportunity for those of us, including myself, who have lost loved ones to suicide, to do a memory walk. They do a luminary walk at night, and it allows you to, it's pretty, they do it downtown, it's beautiful, and they have these luminaries lit up, and it gives people an opportunity to heal. So please consider doing that. That is September 24th, and again, it is down here at the Michigan Theater. And then the other event, and you should be getting something soon from Lifeways, is the ribbon cutting event with the Chamber for the final phase of the renovation. So that will be October 7th from 5:30 to 7. And at this point in time, it is anticipated that it will be in person. With that, I will leave it open for any questions of the commissioners.
Thank you, Madam Director. Questions for Lifeways? Commissioner Snell.
I have one comment. I was happy to see that in Jackson Magazine you were highlighted here.
Thank you.
Appreciate all the hard work that you do,
Thank you.
and happy to be on your board.
That's great. Well, we're happy to have you, so thank you.
Thanks.
I would just reemphasize the ribbon cutting October 7th from 5:30 to 7. I see that in your report. I'm going to put it on my calendar and make sure that the other commissioners know about it as well, especially those members of this committee who aren't here today.
Yeah, because I would just remind the county, this was a definite partnership with the county, and this couldn't have not happened without you. And so it is an opportunity to celebrate that accomplishment and what a great building we have now compared to what it was, and what we were able to provide relative to the diversification of services. So we'd love to have you all there.
Okay, anything further for Lifeways? Thank you.
Thank you.
And now for the quarterly report, the Department of Health and Human Services. I see Zoe come in. I did. Hi, Zoe.
Good afternoon. Thank you for having me here today. I just have a brief report, although I know it seems long because I have a couple of attachments for you all, but those were just articles for your interest. Our Child Care Fund update, we're almost through the state's fiscal year and well within our Child Care Fund budget, so that all went well this year. In Children's Services, just mentioned that the Children's Protective Services complaints have gone down, of course, over these last couple of years, specifically due to COVID. So while we were all completely locked down in sort of March, April, and May of 2020, the numbers went way, way down. They're working their way back up and sort of leveling off now. The article that I mentioned that I sent to you was an interesting article about really what we're seeing now as a result of it. And I think there were lots of concerns, opinions, ideas that there were lots of bad things happening behind closed doors while everyone was shut up with COVID. And what we're finding now is that that's not necessarily the case. And it's one of those things that we wouldn't have wanted to do. We wouldn't have wanted to tell people, don't call, because we want our mandated reporters to be paying attention to our families. But it's just a really interesting article. And I don't think we're done with our learning yet, but it is something, as we are redesigning our child welfare system in the state of Michigan, and really throughout the country, based on the Families First Prevention and Services Act, to be a more front-end support than sort of in the back end when we are placing children in foster care. Just really interesting for us to be paying attention to all of the research that we have going on out there. Yes?
Based on what you said there, it makes me wonder, is it that we're over-reporting, or is it that with the kids, they're working it out with their parents?
Right.
I don't know which way to go on now.
Yeah, I don't think we know for sure yet. I do think that there is some concern about over-reporting. Throughout my 30 years in my career, I've gone out and trained many people about what mandated reporting is, and we've always said, if you're even thinking about it, you should call it in. And I think we're learning now more about implicit bias, and does implicit bias play a role in that? This particular article has us questioning some of that, and so I don't think we know yet for sure. I do also think that, we've had the belief, like we were worried about during COVID, that if we don't know what's going on, then maybe it's something bad. And turns out that it seems like families got resources, and maybe, like a lot of us, enjoyed some of our time together with our families rather than had bad things happen. So I certainly hope for the latter as I continue in my career. So. Our numbers in foster care are down again. A couple of years ago, we were reporting 340 children in foster care. Probably about the beginning of the summer, we were around 200. Right now, we're at 184. And again, a lot of this has to do with just a focus. I think the other thing that I've learned over my 30 years in child welfare is that removing children from their parents, while we need to do that in certain circumstances to make sure children are safe, it is extremely traumatic. And we end up providing services long after for these kids as they get older, because they just want to be with their parents, and even into adulthood, because that trauma really grows with them into adulthood. And so anything that we can possibly do to increase the safety and keep kids with parents, we're doing. And it's less expensive to do that too. So we're just really excited about the way that we're moving, and the kids that we're able to keep together with their families. With our cash assistance, food assistance, and Medicaid programs, you all know by now that we have the universal caseload model. Not every county in the state of Michigan has that, but it's all electronic, and so instead of caseworkers having 500 to 700 cases of their own, they get work that sort of comes down to them through a cloud. And so nobody in our community has their own caseworker except for some people who live in assisted living and places like that where we thought they need that specialized care and attention. But that seems to be going still very well here in Jackson. Just letting you know that we continue to do our race equity and DEI work, and we have a guest speaker coming tomorrow to do a presentation on the history of child welfare in our country, and so I shared a little bit of information about Dr. Carol Wilson Spigner, who will be doing a virtual presentation for us tomorrow. And then finally, as always, I included an attachment of the different community collaboratives that either myself or someone in my staff participate in. So these are community meetings and groups that we are a part of because we can't just do our work in that one brick building. We have to be involved in the entire community to make a difference. So with that, if anybody has any questions, I'm happy to answer them.
Questions from members or commissioners? Always good to see you, Zoe. Carry on the good work. Thank you for doing it, and thanks to your crew.
Thank you. Take care.
Next up on our agenda is the medical care facility. Madam Director.
Hello, Commissioners. How are you all today? So I had quite a few attachments for you in this report, but I am going to start by going through my quarterly report that I send to you. So starting with finances, for May of 2021, finances for May showed a net loss of $294,000, which was lower than budget by $277,000, as the facility had budgeted for a net loss of $77,000 for the month of May. Revenue was under budget by $198,000, and expenses were over budget by $96,000. Census averaged 166, which was 6 beds lower than budget, which was 172. For the month of June, we showed a net gain of $1,494,000. This was better than budget by $1,542,000, as the facility had budgeted for a net gain of $48,000 for the month of June. Revenue was better than budget by $1,466,000. This increase of revenue is the result of tax credits from the Employee Retention Credit Program, and this amount was for the second quarter of 2021. We did not qualify for the first quarter of 2021, but at this time it looks like we will qualify for the third and fourth quarter of 2021. Expenses were under budget by $28,000. Census averaged 166, which was 10 beds lower than the budgeted census of 176. And then for the month of July, we showed a net gain of $423,000, which was better than budget by $420,000, as we had budgeted for a net gain of $3,000 for the month of July. Revenue was greater than budget by $381,000, and expenses were under budget by $39,000. Census averaged 163, which was 18 beds lower than the budgeted census of 181. We did pass a budget amendment in our last board meeting, amending our budget to a census of 154 through the rest of the year. Part of that is due to challenges that we are having with workforce as well. So we'll talk about that here in just a moment, but I did want to share that with you. As you can see, if you have this report in front of you on page 2, you can see the census trend line through 2020 and then into 2021. Anywhere that you see a dark purple box there shows you a time that we were in outbreak status at the facility, where we had one or more positive COVID cases amongst either care partners or residents. As far as COVID-19 goes, we were in outbreak status from August 8th to September 4th. Since our last reporting, group activities have now resumed, as well as communal dining. We have also resumed in-person visitation as of September 7th. However, these in-person visits are set by appointment only at this time, rather than having our families be able to go to our residents' rooms in an effort to try and continue to keep them protected. As many of you may have heard, President Biden made an announcement to mandate the vaccine for all nursing home employees. So details are still forthcoming on this mandate. We had expected the rule from CMS to be published at the end of this month, but since President Biden's newest announcement, it looks like that will be delayed until mid-October. So that is a major area of angst for us. So though we want to encourage our staff to be vaccinated, we do have 40% of our staff that are not vaccinated. Of that 40%, 60% of our CNAs are not vaccinated, and 25% of our nurses are not vaccinated. So we are working on advocacy with our associations, hoping to have some testing opt-out options added into the mandate, but we are also providing a lot of education on the vaccine, hoping that we can encourage people to make that decision. Since our previous report, we have now had 74 residents test positive for COVID-19 and 98 care partners since the beginning of the pandemic in March of 2020. Again, staffing continues to be the greatest area of concern, particularly with nursing. So we have had to make decisions on scaling back our census in order to ensure that we can continue to provide quality care. And unfortunately, that is has a cyclical effect. So when you cut down your census to be able to provide quality care, you can't just immediately increase your census, without increasing your staffing first. So it kind of has this rolling effect. But we are working on looking at some other options to try and help attract and retain staff. One of the challenges that we are seeing is the huge inflation of wages across the healthcare sector, along with vaccine mandates that are kind of taking people out of the field, particularly those in the direct care frontline workers force like our CNAs. We did have a request to go to arbitration from our RN union, MNA, Michigan Nurses Association, and that was withdrawn. We are currently in contract negotiations with MNA. A final offer was presented on August 2nd, and a vote was scheduled for September 4th. MNA did advise their membership to vote no on the contract, and it was voted down unanimously, so we will be talking about the next steps here shortly. We have no outstanding grievances from AFSCME 2098A, which is our LPN and Health Unit Coordinator Union. We do have the request to go to arbitration regarding a termination for two separate care partners from AFSCME 139, which is our service line workers, so laundry, dietary, housekeeping, and CNAs. We also have step 2 grievances that were heard, 3 regarding a termination and 1 regarding a bid. We continue to meet weekly with AFSCME 139 to try and facilitate better communication, try and work through these issues before they get to the grievance level. And we do offer bi-weekly meetings with AFSCME 2098A and MNA, although they do not come to them. Currently, our turnover rate to date is 38.93%, which is higher than our past 3 years total yearly turnover rate. So that is an area of concern for us. I also included graphs showing our CNA mandation totals as well as our nurse mandation totals, showing you the difference between the number of mandations that we've had or forced overtime versus the number of call-ins that we had for each given month. So in wonderful news, we are now ranked as a 5-star facility. This has been something that I've spoken to you on in the past, and we've talked about what it would take to get us to be a 5-star rated facility. So we've been 5 stars in quality for quite some time and 5 stars in our staffing component. But earlier this year, because of our annual survey, which went very well, we were able to move from a 2-star in the annual survey category to a 3-star, which allows us to be a 5-star overall, which is very exciting. And I think that reflects the care that we do provide here at Jackson County Medical Care Facility. that is all that I have contained in my report, but I do know that there was some questions regarding the audit and the explanation for correction that was needed.
Yes. So let's, before we get to that, let's see, are there any questions with respect to the monthly report from members or from commissioners? Any questions? Commissioner Kennedy, please.
Hello.
Hello.
I know on the last page of your financial statement, you've got other revenue showing $2.843 million when the budget was only $13,000. I'm assuming is that federal funds from COVID?
Yes, that's any COVID-related monies.
Okay.
Does it also include the employee retention credit?
Yes, that does include the employee retention credit in that line as well, because it's not something we're expecting to see into the future.
And then I had one other question under administrative services. Human resources is at $580,709. We were budgeted at, well, about half of that, more than half, $225,477. Is there a reason for that?
You know, I don't have that answer right off the top of my head here.
No problem. Would you email me it?
Absolutely.
Thank you.
Absolutely.
Anything else, Commissioner? Thank you. Okay, then let's move on to the audit report issues. And this is something that that I asked the medical care facility to bring to us at this meeting to make us aware of it, so that we might hear the plan for correction. And what you see in the board packet are excerpts from this is the medical care facility's response, I believe.
Yes.
But we've seen excerpts from the auditor's report of material audit adjustments. One with respect to $374,000 adjustment to receivables, and reviewing journal entries and things like that. Now, and I think there was one other related to the fact that census has been down and it's been difficult to make ends meet, frankly, because census has been down.
Yes.
So if you have any comments with respect to that, we'd be glad to hear it. I think the thing I was more concerned about, however, is that it took a couple of letters from the Michigan Department of Treasury to elicit the response that has now been apparently provided. And that's what we're kind of concerned about, or that's what I was concerned about. When you get a letter from the Michigan Department of Treasury, it ought to be all hands on deck to respond, and they ended up having to ask twice.
And I will be completely honest. I could give you excuses, but obviously it all falls on my shoulders when it comes to this. And when we had received the first letter, I had calculated the 30 days being 8/9, which would have been the next business day after the 30 days, which was a mistake on my part. However, that's not an excuse, and that won't happen in the future.
Any questions from commissioners on this point? Commissioner Kennedy.
Have we received a response from the state on what you sent them?
No. And typically, last year, I also had to submit an explanation, and I did not receive a response from the state either.
Okay.
I will say that it does not show on the public treasury website yet. I did go in and verify that it was received, but it does not show for the public portal as of yet.
Okay.
And that was submitted on 8/24.
Thank you.
And in my experience, typically when you see these sorts of comments in audit reports, it's not so much for the state to take action as it is for us to take action, or to take note of these issues and to figure out what's next. And the census issue is is a big one. Like, we get that. And you're between kind of a rock and a hard place to some extent because your census is affected by whether you can take in people. And that's a function of the COVID issue, I suppose. Am I right?
That is. The other piece of that is, as the census has trickled downward, as we've started to make adjustments in our non-nursing staffing and what they're doing, that is going to positively impact the budget. However, the issue is still going to be that over the last 3 years, and this was particularly what they asked for, was why revenues exceeded expenditures over the last 3 years. So they're looking at that trend. So we can work on fixing it for the future, but we can't fix the past trend.
And we as commissioners, of course, we have a MOE millage that props up to some extent the medical care facility to the extent it needs it. So the potential for us to have to take action at some future point is real. So we need to bear that in mind and just remember that.
And I will say, Commissioner, that we are working very hard to not have to request or ask you to look at that in any way. We have been looking at different programs that are out there, like the Employee Retention Credit. This was something that originally government agencies were excluded from, but the rules changed along the way, which made us eligible. Things like that are what I think will help us continue forward. However, looking into the next year, particularly with the unknowns of the vaccine mandate, there are some concerns there, more than what I probably would have stood up here and told you 3 months ago.
Further questions for the medical care? Commissioner Bear, please.
It says in your report, the most common thread through all of these years has been overestimation of occupancy and case mix. Well, if you're creating your staff to handle the larger number of occupants, and for 3 years you haven't had that number of occupants, have you really needed the staff? If you need to start estimating more realistically, and you need to seriously evaluate your staffing.
Yes, sir. And I will say, when it comes to staffing, the nursing staffing is the area of concern. In the other departments, we're doing fairly well. We are starting to see that ripple effect happening in dietary and housekeeping. But most of the issue with the staffing in those departments is because we are a unionized facility, we have to bid those positions, and we can't afford to take a nursing person from the floor and put them in one of those positions. So in all of the union positions, we have looked at those things, and we have started to ramp down our hiring efforts if there wasn't a true need there. Where I'm looking particularly is the non-union positions and how we can utilize those people to fill in those roles, to best utilize them so that we don't have to have a situation where people don't have a position. But I do understand that we have to look very critically at wages and at those positions as we make those changes with our census. And hopefully that budget amendment to 154, right now we're sitting at a census of 163 today, so we are exceeding what we have changed the budget amendment to, but again, we've looked to do that more conservatively so that we can try and keep this from happening again in the future.
Thank you.
Okay, thank you for your report, and we know it's a difficult thing you guys are doing, so keep up the hard work.
Thank you. Have a great
you.
day, everyone.
And now, the Michigan State University Extension. Thanks for being here today.
Oh, no, thanks for having us.
I would note the chair has a meeting in town at 1 o'clock.
Oh, all right.
So
Well,
if you'll move along, that would be great. Thank
we
you.
can handle that. So my name is Brittany James. I'm the 4-H program coordinator here in Jackson County. I know quite a few of you from the Fair Board.
So some of this will be a little bit of a revision, but I'll speed it along for you. So our program overview so far for 2021, we've held 23 programs in Jackson County, serving 193 people. And then statewide programs, which actually have done very well this year. We have held, attended by Jackson County residents at least, 164 that served 578. So as many of you know, when the pandemic hit, we had some issues with processing, and one of the hardest hit industries is our pork industry. So in response to that, Extension actually developed some resources to help producers with their managing the current situation. So as you can see on the right-hand side there, we actually, everyone who attended the event, the pork industry webinar, everyone reported that they'll be able to make better decisions regarding how to manage mass depopulation. They've also concluded that they're likely to use the information presented to be better prepared, and that all of our attendees actually concluded that after the webinar they knew how to find more resources, because this doesn't just go with the pandemic. A lot of the issues that we face can be stuff such as processing facilities. A lot of them are closing. We've had a lot of issues there, but another issue is, if we have any foreign animal diseases and other industry disruptions. So preparing our producers for that is really important to us organizationally.
I'm Phil Tocon with Michigan State University Extension. I do on-farm produce safety statewide. In response to COVID, many of the food safety programming that happened on campus were pivoted to online programming. You may not realize, but there's a lot of mandatory educational events that folks need to attend in order to be licensed, whether you're a licensed restaurant or other facilities that deal with food have to have some licensing. And one of the licensing that's featured here is in HACCP certification training. In general, these were in-person trainings, and there was no online option. So what they did was they created, we created a HACCP certification that's based online, and we saw some pretty significant increases there. In my produce safety programming, we also pivoted online, and we actually saw an increase. We do a pre-test, post-test, and we actually saw an increase of 100% in the amount of change between the pre-test and the post-test, moving from an in-person to an online. So we actually saw significant increases in knowledge.
That's all right, we got this. Another area in which we were able to pivot was helping our youth exhibitors. As many of you know, there weren't a lot of fairs last year, and so providing them with an opportunity to market their livestock animals, Jackson County, we sent out marketing resources to all of our membership, ways to creatively promote your project if there isn't a livestock auction. So this year we actually did a new program called the Countywide To-Go Kits, which were incredibly popular. We actually had more people participating in the To-Go Kits than we've ever had at our when we would do them together in an in-person setting. It allowed families to do them together, to do them when they had time. They didn't have to fit to our schedule. We also offered statewide workshops virtually, which were incredibly popular. Things that we don't necessarily have a leader in, which it was really nice for kids to get those skills without us having to find someone to teach it locally. We also, out of this, developed a new still exhibit club, which is for our kids who want to be in 4-H, want to take things to the fair, but don't want to take animals. So of course, this is my favorite slide because we had fair this year. We are so happy that we had fair this year, and quite honestly, in the 10 years that I've been here, this was the best fair that we've had. Attendance was up, but on our end, people were just really happy to be there, and the kids were so excited to see each other. So we were able to add some pieces that we hadn't done before, do some team building stuff, kind of reconnect with our people, which was really important to me, to the kids, to the families involved. I couldn't have asked for a better year. So moving forward, we're going to be working on developing a mentoring program. We're going to also continue to work with the fair office to develop some more opportunities for youth leadership. And then we're actually working towards the facilitation of youth-led boards. So this week, we're rolling out a couple of new leadership opportunities to youth within our associations. So we have our nutritional and physical activity team. We have FNAP and SNAP grants that fund these positions. We actually have a new staff person, Daniel. He started maybe a month ago? About a month ago. And he's working alongside Angela to develop programs and deliver those around Jackson County. Their contact information is in your packet, so I won't go over that. They are doing virtual, hybrid, and in-person programs. So Cooking for One, Teen Cuisine, Healthy Eating Adds Up, and the Peak Health Performance curriculum. They also are providing programs for parents. You'll see those listed in your documents. From anything from an ongoing series to a one-time presentation as well. And I will leave it up for questions at this point.
Questions?
Is that fast enough?
That was very
wonderful.
well done, thank you. Questions for MSU Extension from members or commissioners? Well, we appreciate the work, glad you had a fair.
Yeah, well, so are we.
Saw the kid
So-
laying down with the hog there, that was very
Yes.
cute and strange,
That's
so.
Yeah, that could be what we could describe fair as sometimes, so. Thank you,
very cute.
everyone.
Okay, thanks so much. Next up, Danielle on the Department on Aging. Thanks for being patient.
Yeah, no problem, thank you. And I just wanted to comment on the Cooking for One class that MSU does. It's a great partnership when they're able to come into our senior center and offer that class. Angela's been great, the seniors are really engaged by her. So again, that's been a wonderful opportunity for us to participate with them. For the report, I just wanted to highlight our MAP program, which is the Medicare annual enrollment. So that time period is from October 15th to December 7th. And that is the prescription piece that's so important, where seniors kind of look at those drug plans to kind of make those changes. It's once a year where you get to make the changes in the plan that you're in. So it's important to look at the medications that you're currently taking to determine if the plan that you're currently in is still the best plan for you. Currently, there's 29 plans that are active right now. We'll find out information at the end of this month what the new plans are going to be, so they could decrease or go up. But it's that time of year where the plans can increase their cost, change their level of coverage. They look at different tiers and things like that. And that's kind of what our counselors look through, is they get all that information together on all the different plans, all the cost analysis, and then they set up those appointments with the seniors that are needing assistance, who aren't very computer savvy, and that want to interface with a counselor or one of our volunteers. So I'm pretty impressed that we'll be able to do 480 time slots. They're about 45 minutes in length, where people can either do a face-to-face with a counselor, or we have one volunteer that's going to be doing just over the phone. So again, that opportunity for our seniors to make sure that the plan that fits for them, because you can't, once you're signed up with that plan, you cannot change it. There are some special circumstances for people that might be lower income. They can kind of move around in plans, but generally that's not what we see a lot of. I put in a couple pictures of some ramps that we worked on with Disability Connections, just to highlight the kind of the great work and the partnership that we have with them. In the cases that we were able to help with this year with the 5 families, one was a daughter and mother situation where the mom was needing assistance in getting out of the home. The other ones were all spousal situations. So again, having that partnership, it's about $4,000 that through that grant that helped help these families that did not really have the ability to pay for a ramp. So again, working with Disability Connections, and they have the volunteers that can do the work. If we can help pay for the lumber to put those ramps together is key in the families getting the resources that they need. With our counseling program, we recently did a survey with that program, and that kind of highlighted some of the responses. I think the most impressive thing, again, there's probably about 10 questions overall, but I just tried to pick some that were pertinent, that I thought you might find interesting. Again, people that reported 95% felt that the counseling helped to improve the problems that they were having in their lives. And again, also that 100% reported that they would recommend that counseling program to somebody else. So those are key indicators for us in knowing that we're meeting the needs of the seniors that are accessing that service. Again, we survey a lot of our programs throughout the year. We're currently working on our congregate programs and our activities, and our advisory council members are coming in to contact our home care assistance clients and our home-delivered meal clients, so they get a better perspective of the services that we provide, so they can hear from the seniors directly, and then they report out based on that survey to us, and that's something I'll report out to you. And on the backside, for me it's the backside, but on your report, under senior fun, I just included some pictures of an Elvis party that we did. That was back on August 27th. It was something we were going to do outside, but with the extreme heat at the time, we moved it to the inside into our lower level, 005 at the Human Service Building. We had 75 people attend, so we were very excited for all the activity in the building. With that, we had 47 people that ate lunch that day, and 28 people just wanted to come and listen to the music. So I think some of the comments that people made to the enrichment coordinator was they just needed to be with people. And so I think when we heard those comments, again, this is what we do. And again, seniors are looking for those engagement opportunities. We did a dance last week, and we had a great band. We had 74 people that dined with us, and actually the 76 attended, 2 didn't eat. But it was a great evening, and we're thankful that we have that opportunity to provide that. Under Moment of Excellence, one of our home care workers was in a senior's home. I can't remember if she was assisting with bathing or personal care, but it could have been a combination of both. But the senior had answered the phone, and we hear a lot about those grandparent scams, and they kind of, hear from them a little bit, and all of a sudden they start sparking up again. But this senior was contacted, and she got really nervous on the phone. Because it was that situation where they're saying their grandchild's been incarcerated and they need help with bail, and she overheard that, and she was listening with the senior and could just see that she was getting very anxious about that phone call. So she asked if she could take the phone, and was able to realize what was going on, and she's educated about those grandparent scams, and she was like, which grandchild was it, things like that, and they kind of started changing their stories. So they knew that it was definitely a scam. This wasn't something that was real. The home care worker contacted the office, and we were able to go ahead and let the family know about that situation. The home care worker also worked with the senior to program her phone so that she can tell when her son and her daughter, and also when that home care worker is calling, because a lot of times people just want to pick up the phone, and they get into situations where they think something drastic is happening with their family. So they kind of crave on that panic situation. So we're glad that our home care worker was able to intercept that, and our senior didn't get scammed. But I can take any questions.
Okay. Questions for the Department on Aging? Good thing that they intercepted that particular little scam. Folks are easily preyed upon. So thank you for doing that. Any further questions? Thank you, Danielle, for coming.
All right, thank you.
Appreciate it very much. And now to the Finance Department. Let's see. We're looking at a Health Department budget amendment.
Yes, I'm Jonathan McGowan, and I'm the senior accountant with the Health Department and the Finance Department. And so the primary reason for this is we have some changes in the transfers in and out, primarily, and these were recommended by Cecilia, in order to make sure that we're at the level we need to be for to maintain the maintenance of effort minimum. And so that's the primary reason for that. Other than that, we have a few new grants. Two of them are for mosquito-borne disease, and which is an increase. Previously, we only had one mosquito-borne, and now we have two, one specific to the EEE virus, and we also have an additional COVID grant that came through that's specifically for support, not specifically related to COVID vaccinations, but so it's for additional supplies, electronic equipment upgrades, additional phones and that sort of thing. So, any questions?
Okay, questions for Finance? The chair will entertain a motion to move the recommendation to the full board with recommendation for approval.
I'll move that.
Thank you, Commissioner Snell. And
Tony,
Representative,
did you have a question?
thank you, the support from Commissioner Bear. Please go ahead, sir.
Under your title, Strategic, these amendments ensure that the 2021 budget is consistent with the actual financial transactions. I need to see a better way of predicting budgets. In the private sector business, I had to make sure that the actual financial transactions met the budget.
Correct.
This is a total reversal. I've been looking at these things for 3 years, and it still boggles me that that we can't budget better than this.
No, I appreciate the input. And I think part of it is specifically, especially with the COVID-19 response, things have changed fairly quickly. And like in this case, we had a grant that came along close to the end of the year. This was additional grant money, so we had no way to predict that that was coming. So that's part of the reason. And with the mosquito-borne type of grants, that's typically based on need. If we have some diagnosis or within the county, then it's based on that need. And we usually don't know that until close to the end of the fiscal year. So that's and resources are being pulled from other departments as well for the COVID-19 response. So it's been kind of a fluid situation over the last couple of years, but I do appreciate the input, and that's something that we will be working to try to predict, but it's been very unpredictable the last couple of years, so I appreciate that, though.
I think the only thing we know about budgets is that they're wrong as soon as we adopt them.
Yeah.
And
we try to do the best we
and of
can.
course, a budget is nothing more than a plan set to dollars.
Yeah.
And as plans change during the year, as you've noted, sometimes that leads to these sorts of amendments. They are difficult sometimes to swallow, but here we are in September, so.
Yeah, yep. Thank you.
Anything further, Commissioner Bear? Thank you.
Okay.
Okay, any further questions with respect to the budget amendment? All those in favor of sending the budget amendment to the full board with a recommendation for approval will please say aye. Aye. Any opposed? Thank you, appears to pass. And now the Health Department. A familiar face. Kristen, good to see you.
We're welcoming Kristen
Yes.
as our new Deputy Health Officer. So Kristen is here to assist. I'm going to try and run the main part of it, and then Kristen's going to answer any detailed questions for us. But early on, program has been a program the Health Department has had for quite some time. I believe since the early 1990s, so many, many years we've had this program. This grant is spelled out under the financial portion. There's federal grant funding as well as ISD funding and Health Department funding as well of $14,500. So we're just looking to continue the program. There's a contract attached to that we would need signed as well. I'm happy to answer any questions.
Questions for the Health Department with respect to this contract? I note that you've been engaged in this since the 1990s. Questions with respect to the contract? Chair will entertain a motion then to recommend the execution of the contract to the full board. Thank you, Commissioner Bear. Thank you, Commissioner Snell. Any further questions with respect to the motion? All those in favor will please say aye. Aye. Any opposed? Thank you. Appears to pass. And now to the Health Resource Advocates position. Go ahead, Kristen or Deborah.
I'll start out. As indicated in our staff report, these are, again, grant funded. We applied for a grant several months ago. Wasn't sure if we would get it. In fact, we are one of the few counties that did. There's several angry counties out there that were not able to secure funds for this. But we were able to, so we're very fortunate. As indicated in the staff report, this is called the Health Resource Advocate for Sustained In-Person Learning, My Safer Schools Grant. It's in the amount of $672,000. These positions are only going to exist as long as the grant funding exists. It's through July 31st of next year. It is one-year funding. We were just notified in August that we received this grant, so this is our first opportunity to bring it to the board. We anticipate that we have funding, as indicated by the chart there that Jonathan put together for us, that we have 4 full-time and 2 part-time HRAs. The purpose of these is to sustain in-person learning at the schools. They will work very directly with the schools in ensuring that we can continue in-person learning in our schools by working with the schools for safe plans, in testing, contact tracing, preventative measures to spread COVID, those types of things. So it's a heavy burden on the school districts that they're doing right now, and we're hoping that these HRAs will assist them and take some of the burden off of them by offering this resource for them. We have 2 part-time positions. We are interested in promoting 2 of our part-time nurses, our existing staff, 2 full-time positions, so they would still be a nurse part-time and they would supplement their full-time position by adding on hours through this grant. So if you have any questions, I think I covered most of it. Kristen, if you have anything to add.
Yeah, we're permitted up to 6, to hire up to 6 full-time HRAs, but at this point, we thought we'd ask for 4 full-time and just a supplement with the 2. We have no idea what the need is going to be and what school districts are going to, take us up on that. So the idea is to have, some of the details are in momentum, but to have one person work with a couple different schools so that that person is familiar with the players at the school district and that kind of thing. So whether it's 1-to-1, maybe at JPS, and, 2 schools for another person, we're not exactly sure that dynamic, but up to 4.
These folks would continue to report to us, the health department, not to the individual school
No,
districts?
not to the individual schools. It is a reporting, it is a hire by the health department, or us here with the county, and report to us here under the Matthew Budd in his department there.
Okay.
The 2 that are already doing, that we're looking to promote are to full-time. They are already doing a lot of this stuff, so it kind of fits in with what they are, and they're very well aware of the funding that could end at any time, so.
Okay. Questions from commissioners with respect to this program? Commissioner Bear.
Good morning, Kristen.
Or afternoon.
Afternoon, yes. I've got several questions about this. In your cover letter, 2EB, what you're supposed to do is help school districts identify emergency COVID-related health concerns and strengthen best health practices by providing consultation, preventive services, and appropriate public health strategies for the district. Well, best health practices is That's more political than it is medical. This pandemic, nothing has been more politicized and manipulated than what we've seen in the last year and a half. Best health practices to me are when somebody comes down with a diagnosis of, or test positive for COVID, you don't do what we're currently doing and just send them home and say, come back when you get worse. That's a horrible practice. Doctors know there's a problem and they're not treating it. If any kid in school is tested positive for COVID, health practice should dictate that you start treating them immediately. You don't just quarantine them and don't call us again until you're ready to be admitted to a hospital and put on a ventilator. You're too late. So healthcare practices is political. And it's not too seldom is it actually determined by health needs. Prevention services, these people are going to recommend prevention services. What is that? Wear a mask, wear 2 masks, wear a face shield over your 2 masks. Appropriate public health strategies for the district. So these people are going to develop strategies that they want the district to incorporate. That's just from your cover letter. You get into the Human Resources Advocate position description. Strengthen best health practices by providing consultation, prevention services. I don't know how they're going to prevent it other than sending everybody home, and appropriate public health strategies for the district. So again, what's a strategy? Put on a mask, put on 3 masks. That all depends on the political affiliation of the person making these recommendations. Serve as a team member, provide preventive services, interventions. Another bullet point, determine a set of health strategies appropriate for the district. So what's a health strategy? Again, masks, lock them up at home for 2 weeks, isolate them. That's not healthy for any person, certainly not healthy for kids in our schools. I've been contacted by, I've lost count of how many emails from parents that say, don't put masks on my kid. My kid's health is my decision as their parent. I don't want to hire some health resource advocate that's going to create these rules. Interprets, reviews, and disseminates model policies. What's their source for these model policies? A lot of policies I've seen for the year and a half I don't agree with at all, and most of the parents that contacted me don't agree with them either. There's one that was really disturbing to me. Recommend limitation on movement of populations. These people are going to have the authority to shut down our society again. Everybody's going to be quarantined for another 6-8 months. I'm going to not go through my whole list of all of these because I got more and more and more. What I see that these people have the authority to do, I can't support this. And I don't care if we're not paying any money for this. If it's free and it's a poison pill, I'm not going to take it. The fact that it's free has nothing to do with my decision. We're putting people that we don't know, and I'll say it again, COVID's been so overly politicized. It's going to depend on the political affiliation of who you hire, what kind of recommendations you get. If that's free, I still don't want it. To me, it's not worth taking the risk.
Commissioner Bear, one of the reasons I asked the question that I asked is because I too have a concern as to who will ultimately manage the folks that are doing this work. And I think the answer I heard is our health department, and ultimately we will be the ones who are managing what is done. They won't work independently. And so I don't know if that is adequate to satisfy you, but I need your vote if we're going to move this forward to the full board. If you're prepared to vote yes, we'll call the question. If you're not, then I will not.
Well, that question about the ultimate decision-making is with other people, not these 6. I don't see that in the Health Resources Advocate position description. I don't see that worded that way in their cover letter here. It doesn't say that these people are going to recommend policies back to the Health Department, and the Health Department will either affirm it or reject it. It says these people are making these recommendations straight to the school district.
If I can interrupt, there are employees, so they report to us. So it doesn't really need to indicate that specifically because we would be doing the hiring and they report to us under this grant. It's our grant money, so we have the ultimate control and authority over the staff. Just like any other employee that we would hire, we have the ultimate authority over these employees. And as Kristen indicated, they're reporting to Matthew Budd.
Well, and just to jump in on that fact, what we're hearing and why we're going forward and why we looked for this funding is we hear from the school districts all the time. One of the big problems we have right now is the school districts don't have the staff, don't have the time to do any kind of contract tracing. So you've seen some quarantines that are all over the place with one school coordinating a whole class just because someone came in and tested positive instead of keeping 90% of that class within the classroom. And then the other one saying, nope, we don't have time to do it, we're not doing anything. So it's to provide that resource, a health department resource, a health department employed resource, using our guidelines and what we tell them. It's not, they don't get to make that decision. It's based on the health department and ultimately you and where we, the guidelines and you mentioned the limitations, and a lot of that is like a planning on, the schools have to have a plan on what to do if they've had an outbreak in their classroom or in a specific setting. So we can help put that plan into effect with these extra employees. And the fact is, we can't do that right now with the employees that we currently have. So this, may give an opportunity to help them better manage, their own risks.
We'll stand at ease for a moment. Yes, go ahead, Mr. Gary.
Tony, I want to give you an example of something that I experienced firsthand that's going on with the school districts right now. And it's one that my son attends. It's one that's in my district, and it's also affected a kid that I employ. So I'm going to give you an example of how the schools are currently a little overwhelmed, and they're not really implementing an effective strategy. So this young man played football on a team with a kid who tested positive for COVID-19. He had no symptoms. They quarantined him anyways. He went home. He tested negative. His mother waited another 3 days. He tested negative again. The school's recommendation is to still quarantine him for 14 days. In my opinion, I'm not a health director, I would say that's an ineffective strategy. As a matter of fact, I I stated, you can come back to work. You've tested negative for COVID-19 twice. But that's the type of stuff that's going on, particularly the JPS quarantine. More than likely, more kids were quarantined than were actually necessary, and an expert is needed to be there to give these administrators recommendations. Otherwise, they're just blanketly saying, take 2 weeks off. That's happening. I just told you a situation where it did, just so you know.
And that's something that I would like to avoid. If the school or these health advocates are going to say that the kid is sick, you have to stay home, how do medical professionals take a person that's sick and not treat them? Just go home until you're much, much worse and we got to hospitalize you. The only reason you get worse and need hospitalization is that no intervention, no medication was given. And we've got, I'm not even going to get into a list of all the medications that are available. They weren't given to people for politics, not for medical reasons. And the court cases that I've read where just last week, Texas governor intervened on a 98-year-old World War II veteran in a veterans hospital, tested positive for COVID. They did nothing for him. They just put him in isolation and they didn't even feed him. The family finally got a hold of the Texas governor and they went in, his intervention crew went in, and they put some ivermectin in his IV. 15 minutes, there was visible improvement. They gave him a second dose in his IV. Another 45 minutes, he was remarkably improved. So that gentleman, when some intervention was actually given, he went from the doctors telling the family, he's not going to last more than a day, to the guy's doing fine. A huge improvement in his health because the doctors not the practicing doctor, Texas governor's intervention team went in and said, no, we're taking over this patient. And they saved the man's life. So this is just too political. And when people don't prescribe treatment for people that they consider so sick, they got to stay away from everybody else. That's just criminal.
Commissioner Shotwell, please. Commissioner Snell.
Thank you, Mr. Chair. I'd like to say a couple things. First, I have the full faith in our health department to manage this program appropriately. I don't see them giving these health advocates the power to do whatever they want. They'll be under the guidance of our health department. And I have to say, over the years, my thoughts on people being sick at work have changed. When I was starting out and managing businesses, it's like, unless you've lost a limb or you're dead, you come to work. And then I noticed after a few years, when somebody came to work sick, more of my staff got sick. And it was better to allow them to stay home and recuperate and get well. So I'll be supporting this.
Thank you, Commissioner Snell. Any further comments?
I may, Mr. Chair.
Mr. Scheer.
With all due respect to the members of this committee, I would ask that a motion be made of no recommendation to forward it to the full board, so all 9 commissioners will have a chance to speak to this issue, and all 9 commissioners can share their opinion. I think it would be appropriate and responsible action, and Phil, you can think back, we've had other items come out of committees before that were not recommended by those committees, but again, allowed to have all commissioners speak on them in the past, and I think it's appropriate and a responsible action that if there is a division within the committee, that you send this forward to the full Board of Commissioners to make a decision with no endorsement. Just move it forward. And you can make that recommendation, and that can be the wording of the motion. But I would hope that you would allow myself and other commissioners the opportunity to speak in front of the public We were all concerned Tuesday morning of actions that we were taking, that it needed to be done Tuesday night. I think it'd be appropriate that this goes forward to Tuesday night and a decision be made. That's my 2 cents worth, if you would. Thank you.
Any commissioners who wish to speak to that? Commissioner Walls, please.
Just a question, Kristen. Will these people be going into the schools?
They could be, or they could be on the phone, just on the phone with them, or doing guidance, but that's the key, is that they can go into the school. We can have them go into school. When a teacher is saying so-and-so was sick, they left the classroom, that kind of immediate response, we can see how many, the distance of chairs, the distance of, lab partners, or whatever that situation might be, that student or that resource advocate can go in there and say, these are the people, whoever were in these 3 seats are the people who need to quarantine. The rest, based on distancing, and that we wouldn't need to quarantine.
So, being a healthcare professional, as these people would be considered, they're going to go into the building and make an assessment. So the principal walks up to them and says, well, I got this, what do you think?
That would be based on their guidance that we provide from them, the guidance that we have a whole list of resources for schools and parents and teachers on our website right now that was created by that wing of the health department that is currently managing all of the COVID outbreak information. So that would be based on theirs, and it would be, Deborah, you can, tell me if I'm wrong, but it would be, it wouldn't be their place to speak out against something that was, that we were not recommending or guidance. It's based on the guidance that we're providing as the health department.
If I can add in, we did speak with the superintendents about this grant and this opportunity. Otherwise, we would have not applied for it, and they are completely on board. They would like the help in order to do things appropriately, because I think Corey mentioned schools are all over the board on what they're doing. And yes, we have heard where they're, quarantining entire classrooms when that's not necessarily what should be done. So the schools are on board, the superintendent's on board, and they're welcoming the help and looking forward to having the help so that they can handle this appropriately and quarantine only those that are necessary and provide guidance that is necessary to get them through the day and have in-person learning for our kids.
Well, what I can see happening is that we send that person out there to evaluate, bring the information back, and they get asked the question. And the question gets answered whether it's right, wrong, or indifferent. They're going to expect an answer from that person when they come. Well, I can't answer you right now. I got to take it back to the team and see how it goes. That's probably not going to be the case.
No, we would anticipate this person would be up to date with CDC, DHHS, and our guidance, and they would be able to answer questions on site for the principals that they're working with, the superintendents they're working with. They would be able to make decisions based on our guidance, and, again, continue the in-person learning that our students are able to have.
Commissioner Duckham.
Thank you. I'm going to read from this letter here and ask for interpretation, I guess. These people are to contribute to public health prevention measures. Does anybody envision you must wear masks? There's an opinion in the school. This guidance person comes in and says you must wear masks. That's her opinion. I've probably answered 50 emails, people asking me not to support mandatory masking in their school. They don't want their child masked. Here's another one. Recommend limitations in movement of populations. That could get scary.
What they're doing is they're recommending limitations if necessary throughout the school. Again, it says multiple times in the staff report that this is for the schools. So hundreds of kids in the hallway at one time may not be appropriate based on what's going on in their school district. Jackson Public Schools has an immunization rate of 10% for the public school in Jackson. So their recommendations might be a little bit different than Northwestern or Western schools based on what's going on. Are they going to require masks? They do not have the authority to require masks. These are nurses. They can do what we have done as a health department and strongly recommend masks. We have not mandated masks. This person works for me in the health department, so they will not have the authority to mandate a mask unless I do so myself.
Well, do we put this in writing?
Pardon?
It don't say that, though. And I trust you, okay? But it don't say that. It says, contribute to public health prevention measures. That could be wear masks.
Mr. Administrator.
Yes.
I understand exactly what you're saying, have some of the same fears myself. I would tell you this, though. Right now, we have no real direction. We have 13 school districts doing whatever they feel is appropriate. And frankly, I have much more faith, nothing against those superintendents and the principals and so forth. I have much more faith in our people at our health department to be consistent and in line with the thinking that has been evident from this board from the get-go. If we leave it to no one, I mean, if we don't put anyone there or do anything, it's up to them to do what they want. I don't think they're going to be nearly as good at it as our trained people are.
Superintendent X works for the people in his district.
That's correct.
Okay? We're really letting him off the hook here by, well, the health department recommended I do it, so I have to.
Well, frankly,
he works for the people in his district who have the kids at the school.
I think our health department will do a better job, Phil, than the schools will do.
I'm not sure. We went through this last year a little bit.
Well, I understand, but there's been some changes since
Then
that
let's
time.
change language. Why should we be able to limit the movement of populations? It's what it says, limitation, recommend limitations in movement of populations.
So, Phil, then you don't believe...
Who did that?
I understand what you're saying, but let me
that's way extreme, but...
Let me give an example what Deborah alluded to. If they have some people in a class that are infected or whatever the case may be, should they be allowed to just walk down the hall with the other 1,000 kids or whatever kids are in the hallway? I think that's probably what they're alluding to, is saying...
They shouldn't be in school if they're sick.
Well, I agree, but you see the point of it is they got to get out of the building to, you know, I mean...
The first thing that comes to my mind...
The administrator has the floor. Let's let the administrator finish.
I would leave it with this. I understand what you're saying, and it's not a perfect world by any means in this world we're in right now, or nor will it ever be, but I still would put more faith in our people than having 13 different school districts do 13 potential different things. It is confusing to the public and parents, and I would rather be consistent. Even if I'm consistently wrong, at least I'm consistent, as opposed to what we will see, the inconsistency and confusion, and therefore that much more disenfranchised people with government and authority.
Look, I've been lied to by all kinds of people. I've been told, get your vaccination, you don't have to wear a mask. That come from the top. Now he changed his mind. Okay? Now it's come down to where if you have 100 employees in your business, you must make them get vaccinated.
Phil, how
it
is
isn't
what,
their choice.
How is what you're proposing better, though? To have everybody do
recommend limitation
whatever
of
they
movement
want.
of populations.
Are you suggesting that the schools should be able to do whatever they want? Because they can, is basically what
Well,
we're
I
doing.
suggest we at least clean the language up. Because who says the health department, if they can do it at school, they can certainly do it at the Westwood Mall. So no, they can close down the Westwood Mall.
We are looking at the health department.
But that ain't what it says.
It does. It's these people are health department.
No, I mean limitations of movement of population. D, background. D, additional staff, I won't read it all, contribute to the public health prevention measures. So they contribute, they make recommendations. Everybody wears a mask. Okay? Then they leave it up to the local law authorities, am I going to give you a ticket if you don't wear a mask because the health department told you to? Now we get confused. Then recommend limitations in movement of populations. Well, we all gotta quit driving? I mean, where can this go? I know the intention, but where can this go?
I can tell you, if we don't do anything at our level, then the state will just impose something at their level. Right now,
Well,
they've
there's a
left it
point
to
in
local health
time-
departments.
There's a point in time where you gotta stand up for yourself.
Well, I agree with you, but I'm suggesting that we're better served with our people making those decisions as opposed to the state MDHHS.
Well, you know,
Or
we
leaving
went-
it up to the school districts to do whatever they
We
think is
went through a
right.
year and a half of a dictator in Lansing telling us what to do.
Agreed. so-
Now we're gonna just, she was illegal. Now we're just gonna go down to where now the health department can do it for her.
Well, they do work for the county.
They work for us.
I understand that Ray said that there was a committee or a judge that said you can't interfere with your health department. Was that correct? Ray?
Well, okay, this is,
And,
whoa.
Yeah.
Okay, this discussion has gone far afield.
Now you got
Yeah.
a no vote then. No, I say I do Tuesday.
Yeah, that's what I'm saying.
You're alienating your voters.
Right now,
I know that right now. What we say is going to happen, it doesn't say that on paper. Clean it up.
There's a motion on the floor. Madam Clerk, would you call the roll? I thought we had a motion. We do not have a motion. Okay. I'm sorry, I beg your pardon, Tony, I was wrong. We don't have a motion. Are you prepared to make a motion, Tony? Well, how about let's get a motion on the floor and then we can speak to the motion.
I'll move to send this to the full board without recommendation.
Without recommendation. And do you support, Tony? I'll support. Okay. Comments to the motion. This is to move it to the full board without a recommendation. Commissioner Bear. Speak to the motion, if you would, please, sir.
Yeah, it's relative to the motion. Certain people I trust. Deborah has earned my trust. I like the way she's run the department. I like what Kristen has added to it. But we're going to be bringing on other people that I don't know and I don't necessarily trust. I'm concerned about the language in here. We state that these people will report to Deborah first. Put that in writing. If you want me to support that, put that in writing so I can read it. Instead of just having a description of what these people can do, part of that description is they will recommend these things back to the head of the health department.
I thought it was clear earlier that these folks will report to the health department, which then ultimately, eventually reports to us.
That was verbal. I'm saying put it in print.
Well, Commissioner Snell, I'm for a motion. I would like to hear a motion to amend.
We'd like to hear that. Actually, I think that it could be amended.
Yes.
I think that the health department could come back after.
Mr. Chairman,
hearing
if I
the
may.
concerns here.
Commissioner Snell has the floor, sir.
Make
Thank
changes
you.
that might make sense.
Any motion, Commissioner Snell? No, don't. Okay.
Well, without knowing exactly what needs to be, how it needs to be amended, I'm not ready to do that this time. I trust the health department to come back with changes on that before we meet on our Tuesday meeting.
Any further discussion? Mr. Chair.
Speaking to the motion, administratively, the staff has in the past added documentation or clarified items that have traveled from today to next Tuesday. So the Administrator Controller's Office could review and put that language in that's being verbally requested by Commissioner Bear and have that in the documentation when it's presented to us Tuesday night. And I'm getting a nod from our administrator. So I think that would be easy and appropriate to handle, and you don't need to do any amendments or anything like that. That would be my thought. Just leave it at no endorsement.
No recommendation, okay.
No recommendation, and send it to the full board with the understanding the Administrator Controller's Office, through the Chair and Vice Chair, will correct the language.
Okay. Madam Clerk, call the roll, please.
Commissioner Bear?
No.
Commissioner Snell?
Yes.
Committee Chair Pulaski?
Yes. 2 yes, 1 no.
Yes, 1 no.
Okay, thank you. And now, Kristen, if you'd like to do the monthly report. Are you getting tired of standing there?
No, I'm good.
Oh, good for you.
I'll
Okay.
make it brief. We do have our monthly report in there. There's some charts in there. If you have specific questions, we're happy to help. We did finish some of our summer programming, so that information is in there as well, with regard to the Get Real program. And I just wanted to add for Commissioner Walt's earlier questions with regards to the well and septic. Don Haydick, our Environmental Health Director, is here. I believe he may be able to answer some of those questions for you or assist you in pointing you in a good direction on who can help from last meeting, the questions you had. So if you have any questions, like I said, I'm happy to answer. With regard to COVID, a brief COVID update, our numbers, as I indicated before, we do see a trend up. We're still seeing approximately 30 to 40 cases per day. We are seeing an increase in the school-age kids as well, under 19. And our deaths at this point are at 298 for the county since the onset of the pandemic. We're trying to dig deeper into some of those numbers and watch some of the trends. So if you have any questions, again, I'm happy to answer specific questions. I know Commissioner Pulaski had a time frame that he needed to be done, but.
The time frame is long since passed.
Sorry. If I may, I would just add on to that, just of note that since I think it was August 23rd, if that was the Monday, whatever that Monday was of that week, the WIC office is completely open. All staff are back working within the office. Immunizations have been working, but they are open 4 days a week for immunization, for walk-in and appointments. So it's almost like business as usual back in the health department, as opposed to with other services, not just COVID services.
Thank you. Any further questions for the health department? We'll move on to the next item, which is claims. Chair will entertain a motion to pay the claims. Thank you, Commissioner Bear and Commissioner Snell. Any questions? All in favor will say aye. Aye. Any opposed? Appears to pass. Please take note, Commissioners, of item 5B, the DHHS board meeting minutes of, I believe it's July, and of our reporting schedule in item 5C for next month, the Department on Aging, the Health Department, and Lifeways. We have come now to public comment. Any public comment? Any public comment? Public comment is now closed. Now committee member comments. Committee member comments. Okay. Chair will entertain a motion to adjourn. Thank you. Commissioner Snell, Commissioner Bear. All in favor will say aye. Aye. We are adjourned.